show. It's a little bit more challenging.
I bet.
Yep. Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. As more often than not, that happens on this show, a guest is referred by a previous guest, and Linda Middlesworth referred this next guest, who I actually heard speak at her conference earlier this year. She is double board certified in Obstetrics and Gynecology and Lifestyle Medicine, which I believe is the newest certification in medicine, and a very important one for at least me and the people that follow me to go to, in my opinion, regardless of the doctor's specialty. And her name is Dr. Debra Shapiro. It's so nice to, we've been on the cruise, but to officially meet you.
Yes, thank you so much. It's such an honor to be on your show.
Oh no, the honor is mine. I get to meet the most spectacular people that if it wasn't for the pandemic, I might meet, but maybe I wouldn't, or at least I wouldn't have an opportunity to glean what we're going to glean from you today. Because actually, whenever we have a doctor on, we get people that send in lots of questions. And this is, it's funny because I go through a 44-year vegan. I don't know any plant-based doctor that's an OBGYN. And then I meet two in 1 week. So one was on the show I just didn't know that was his specialty. But this is fantastic because you got to get these people to start out right. And hopefully you can.
Absolutely. That's what I'm all about. Trying to make a difference for the future generations. Yes.
So before I find out what you do as a plant-based doctor, I'd love to hear your story because I don't believe I know it, because obviously I'm guessing you weren't born a plant-based eater. So when did you first hear about the plant-based diet? When did you become plant-based yourself? And then when did you start incorporating it into your practice?
Thank you for that. It's actually, I just want to say one thing. I have your voice in my head all the time from things that you said. So I'm always telling my clients, if it's in your house, it's in your mouth. So, and I'm always using your calorie density charts. You're just wonderful. So thank you for being who you are.
Oh, thank you.
Well, I was raised in the 70s, and my mom didn't like to cook, and I was raised on a lot of terrible fast food and processed food. I think we ate meat and dairy at every meal. I had Spam and eggs. We had cheese that wasn't even real cheese. It was the cheese slices in the plastic. And actually, I wasn't that healthy as a kid. I had a lot of strep throats and I was on antibiotics a lot. I had ear infections. I always had a stomach ache and, a lot of issues. I had acne later, constipation. I mean, really a mess. And there was a lot of suffering in my household. My mom was she had fibroids and bleeding and had to have a hysterectomy soon after I was born, and then developed diabetes. And her diabetes was very difficult to control. And of course, at the time, everyone thought it was just carbohydrates. And she went from being on oral medication to insulin, and then many shots a day. So that she was basically almost homebound when I was just a teenager and quite miserable. So it was actually a lot of suffering that I saw. And then she got a brain tumor and actually died when I was quite young. But so after a few years of sort of being kind of a waif, a hippie, finding myself, I did become a vegetarian at 17 out of animal welfare concerns. I didn't understand about eggs and dairy at all. I didn't understand about the cruelty behind those industries, but I did eliminate meat. And I did that until in the middle of medical school. And then I developed food intolerances, and I couldn't eat onions anymore, and I was lactose intolerant, and it became intolerable. And I went back to just eating all foods and really losing my way in terms of any understanding about animal welfare anymore. Wasn't until a patient came to me many years later. I was a foodie. There's this whole living well is the best revenge when you're in medical school and afterwards, and I was just eating at the best restaurants, and I had no regard for anything. I didn't make the connection between health. And there were a lot of health issues in my family. There were cancers, diabetes, Parkinson's, a lot of problems. Never made the connection between food and health until a patient came to me with a miscarriage, and turned out she had mercury poisoning. And I have to say at about that time, I was starting to move away from red meat. I don't remember why, but I was eating a lot more fish. Turned out I had mercury poisoning also. And so I really started looking into this, and it got me thinking about sort of the what was in our food. And it was a patient. And what I love about obstetrics and gynecology is that you get to see the same patients year after year and really develop a relationship with them. And I have to say, for all the ones that I've helped, I feel like I've been helped by them as well. And I've learned so much from my patients. So it's really been this mutual appreciation. so this a vegan patient told me about initially Farm Sanctuary. And I visited and I had this incredible sort of really a revelation again about animals. And I really could kick myself for having been off of all of it and really not paying attention for all those years. And then that same patient came back and told me about Michael Greger's work and nutritionfacts.org. And it was then that I really just sort of, things just took off. I started just immersing myself in the science. I started going to all the conferences, the International Plant-Based Nutrition Healthcare Conference and the Plantrition Project's International Conference on Nutrition and Medicine. And just trying to reading all the books and learned. I took the Colin Campbell course. And then I started to try to incorporate it into my work as an obstetrician gynecologist. I also tried to encourage my fellow doctors and the people at the hospital by bringing in speakers and having a speaker series. It was a tough nut to crack. And then I became a health coach. So my practice sort of evolved, things changed in my practice. And now I practice at Genentech in their clinic part-time, and I'm a health coach also.
That is great.
You know, a long story, sorry.
No, please. I love as much detail as possible. I always think about how if something isn't good for a baby, how could it then be good for a grown-up? Because I always think about people that often when they are pregnant, they will quit smoking. They will stop drinking. They'll stop eating fish, but then they'll go back to it. So where is this disconnect where, like, I mean, where do they think, well, if it's not good for the baby, how is it good for the grown-up either?
Well, so we have some big issues because we do have the Academy of Nutrition and Dietetics, right? It used to be the old ADA. They have now come out and clearly stated that a well-planned plant-based diet is appropriate for all stages of life. But that was pretty recent. And really, the American College of OBGYN is certainly not really promoting plant-based nutrition. They'll say things like, we should try to help women lose weight before they conceive, so they have a more healthy weight before they conceive. But they still actually say that you should have two servings of fish a week, and they still say that you should have 3 servings of milk every single day. Dairy. It's very new that the U.S. dietary guidelines have now said that you can substitute a fortified soy milk for dairy, but this is very new. So, we have some big issues, but you're absolutely right. That really strikes me very, very clearly, that women are willing to do just about anything you tell them to do to have a healthy child, but they don't know. There's a lot that they're just not being told by their clinicians about not only food and lifestyle, but also all the environmental toxins that we're exposed to. I mean, this was very new for me to learn about this. I mean, it started with just learning about mercury, but it's not just mercury that's in our fish. I mean, there's dioxins and there's PFAS. There's these lasting chemicals, these forever chemicals, they're called. There's PCBs. So, people wonder, why is the salmon orange? Well, the salmon is orange because it's given food coloring. And then just the understanding that the word natural flavors, that's not natural flavors. I mean, who knew this? We're exposed to thousands and thousands of chemicals. And then when they're brought into our bodies, they turn into other chemicals and they interact with each other. No one knows. I mean, we can look at one particular, like a paraben or a phthalate, or a couple of those phthalates, and we can do studies and see, what might be changed in the embryo because of exposure. But it's not just parabens and phthalates and BPA and PFAS and on and on and on, but it's also what they all become in us. And really, it's a little overwhelming. There are things that we can do, though. I don't want people to feel like, well, just give up. I mean, if you live near a freeway, what can you do? But there are things that you can do.
That's great. One of the things that I'm most interested in is weight loss. And, we're getting heavier and heavier as a society. And I'm wondering, what are the risks of going into a pregnancy when you're already overweight or obese, not just in terms of the mother and the delivery, but the future health of the child?
Yes. Well, this was incredible to me. So this was sort of the last piece of the puzzle. I'm so glad that you asked about this, because when I was at Genentech about 2 or 3 years ago, I was asked to give a presentation to the whole company, and I decided to do a presentation on emotional and physical preparedness for pregnancy. So I did this sort of deep dive into the research about preparing for pregnancy, because I remember what I used to tell patients take your vitamins, make sure you're getting your folic acid. But I really didn't know everything there was to know. And I apologize deeply to all of my patients. I was probably the only one checking for mercury, but there's a lot more. So there's an article in a magazine, which you can all find. It's called Contemporary OBGYN, but it's not just for OBs. Anyone can read it. And in 2016, researcher wrote an article called Maternal Obesity in the Fetal Brain. And this was really amazing, because it's something that I've been thinking about for decades. When I look back at some old journals, and I was sort of writing this play about pollution and its effect on violence in the communities, way back in the 80s, before I even was a doctor, before I knew anything. Well, it turns out that maternal obesity, a high-fat diet, and excessive weight gain, they cause a decrease in the IQ of the child. They cause emotional disorders. They increase the risk of autism spectrum disorder, of ADHD, and they lead to future problems with obesity and problems with food addiction. So it's just, and fatty liver and early diabetes. And I mean, I could go on and on. I mean, it's everything that you know, right? Because it's all about the same drivers of disease. It doesn't change, right? It's oxidative stress, it's lipotoxicity, it's inflammation, and it's dysbiosis. So it's all the same. So you eat this bad food, and then that they're not even talking about the endocrine disrupting chemicals that have a similar effect and also lead to more, to obesity. And so we have to stop this, and we have to stop it before people conceive. You were asking just before about what can happen. So what happens is the pregnancies get complicated by things like diabetes in pregnancy, and preeclampsia, hypertensive disorders in pregnancy, and preeclampsia, and then they need inductions of labor. And with inductions of labor, you get failed inductions, and you get prolonged labor, and you get the uterus being sort of hypotonic and not being able to contract anymore, and cesarean deliveries and hemorrhages, and this is a huge problem. Not to mention then, infections afterwards. So I know that it's interesting about obesity and how we both think of it as a problem to be solved, right? But for a lot of women, it's very emotional, right? And it's hard to actually tell a patient, you're heavy, right? You're overweight, you're obese. This is a serious problem, because it's tricky. It's tricky. I know you're a coach, and you're not a doctor, but it is tricky. And it's tricky whether you're a coach or a doctor. But you can't turn people off. Fat is being fat is a very emotionally charged issue for women. And I think just knowing something intellectually, well, you could be hurting your child. I don't think that's going to be enough. Like, we all know that the behavior change is only 20% information and really 80% transformation. So that's what coaching is all about, really helping people to find out why they might want to be different, why they might want their lives to be different. But hopefully, I really want the next generation to be healthier.
Right. Well, once somebody's pregnant, is it too late? I mean, like, they wouldn't want to go on a reducing program once they're pregnant, right?
No, you can't. I mean, I think you could always make changes in what you eat. But will you really make changes? So that's what people have looked at. People don't usually make huge changes once they're pregnant. And I just want to point out that a lot of pregnancies go undetected for quite a few weeks. And these early changes, these changes related to obesity and these chemicals, these happen when you have just a blastocyst, just an early grouping of cells. You do not know you're pregnant unless you're, super aware, or getting these early pregnancy tests, or you had a prior ectopic, so someone's checking you from day one, 2 weeks after you can, after you might conceive. But most people really go almost months before they know that they're pregnant. So I think it might be too late. Honestly, the best time, especially because you want to increase fertility, and you can increase fertility by reaching a healthier weight. There's a wonderful book by Jorge Chavarro and Walter Willett called The Fertility Diet that looks at the Nurses Health Study work, and they actually look at the optimum weight. It's like a BMI of 20 to 22. It's a really, a small window. But a small amount of weight loss will help improve your fertility. And other things too, of course, like exercise, aerobic exercise, and sleep will all increase fertility. But infertility today, maybe we're not thinking about it so much with the pandemic, but at any other time, people are thinking very strongly about getting pregnant. And infertility is, at least in the West, an increasing problem.
Were there any increased risks and challenges for people that got pregnant and had to deliver during COVID?
No, there are a lot of challenges now. Yes. I mean, I'm not in the delivery room anymore, but I know that they were very limited as to who could come in. Right. So you were only allowed one. I mean, normally women would have a doula, for example, a birth attendant to help them, or they would have a few family members like their mom and their spouse. Many women want their mother and their spouse in the delivery room. And this was not allowed. They were only allowed one, and possibly even none. I'm not sure. At the height of the pandemic, I'm not sure who was allowed in. And certainly just the idea that you couldn't go in and out of the hospital freely. Even recently, or an elderly relative was in the hospital and her daughter was allowed in, but if she wanted to go to get a sandwich in the hospital cafeteria, she would not be allowed back on the floor. It was one in and out a day. So it's been very stressful, and not to mention the stress of just worrying about getting sick while you're pregnant, and now the vaccine. And so it's all, this has all been a very challenging time, and birth rates have gone down because of it. And I'm happy for that, because actually on top of the food, on top of the lifestyle, on top of the exercise and the sleep, stress also plays a role on the epigenetics of the embryo and on the fetus. So, and we know that from World War II studies, but we also know it from more recent studies, the Project Ice Storm. There was an amazing ice storm in 1998 in Quebec. It was minus 20 degrees, and for 40 days they lost power, and people were stuck, and there was tremendous social upheaval. And they followed the children of women who were pregnant during that time for 19 years. And they found changes in their epigenome, the epigenome meaning on top of the genetic material. So when we talk about changes in the epigenome, we mean not that the base pairs of the chromosomes have changed, the base pairs are the same, but the gene expression has changed because of a number of different factors like methylation or histone modification. But the gene expression has changed, and it's changed through, and it can change for generations. It can change not only in that person, but in that person's gonads, in their ovaries. So it'll change their grandchildren's genomes as well, gene expression as well. And they found changes in their immunoglobulins, changes in their glucocorticoids. So the way these children are going to handle stress, the children of people who went through this ice storm in Quebec, those children are going to handle stress differently in their lives. And I think we see that, and we know that that's true. People who have survived slavery and oppression, and people who have survived pogroms, right? We know that the generations later still carry the scars in their DNA of that trauma.
Wow. Now I might be getting this wrong, but I believe hearing Dr. Furman give a talk saying what we eat today can affect the eggs of like our great grandchildren. Like that's mind blowing.
Yes. Well, inside of us, we have our ovaries, and inside of those ovaries are these eggs, and the eggs. And if we're pregnant, then the eggs inside of the child that's inside of us, yes, is going to be affected. I really would love to test. We have a program called the Pregnancy Advantage, which is really putting all of this together. It's a coaching program to help women get ready for pregnancy, and not just women, actually men too. We didn't talk about that, but men also. There's the semen analysis and the sperm, and all is affected by not only just radiation, things like keeping your laptop on your lap and sitting in hot tubs all day or wearing tight bicycle shorts, but also a high fat diet. And actually, paternal obesity seems to be a risk factor for autism spectrum disorder in the offspring. Isn't that amazing? I mean, sometimes we think, well, the man just, he just gives a sperm and there we go. It's all about the mom. It's all about the mom, but it's not. But there is a lot that the mom, because she's carrying this child, and so the stress that she's experiencing will actually be carried through. But absolutely, these traumas, what's good and what's bad, can get carried through for generations. And I say, let's stop now with all the damage, and let's try to heal this damage by just filling our bodies with healthy food and paying attention to sleep and exercise and stress reduction, and having healthy relationships, and reduce our exposure to this myriad of toxins that we're exposed to. And I think, right now we've been sort of as unwitting participants in this great experiment of bad food. I mean, I was eating Cheese Whiz as a child. I was putting Cheese Whiz on Ritz crackers. This is the food-like objects, right? That's what Michael Colin calls them, or what? It's very unfortunate. And I don't know how much a person can do now that will make enough of a difference. But if we reach people before they are thinking about conceiving to optimize their health, we can have a healthier future. And these children will be raised knowing that it's okay to eat whole plant foods, and they won't be craving, right? They won't be craving the high fat, the ice cream sundaes that I made for my brother every day.
Wow. That's amazing. You were talking about mercury toxicity earlier. How does one know they have it? Do you do a test for it?
Yes, it's a very simple. There is a test, and actually, there is a grouping, a test that you can take, that you can get, it's for heavy metals like arsenic and lead and mercury. So you can get that little grouping. But I was just testing for mercury, and I've heard about hair tests, but I just got a blood test. And when my patient came in with the miscarriage and told me about her extremely high mercury level, and I started thinking back at what I was eating, and for any of you who have gone through a period of being sort of a pescatarian, and you know how easy it is to get tuna fish sandwiches for lunch, which, by the way, I went to school with every single day, was a tuna fish sandwich, which you could not do for your child today. You couldn't, because it would be unsafe, because our waters are so polluted. But also I was eating sushi a lot. When we went out to eat, instead of getting the meat, I would get the fish. We were making, salmon. We were making orange roughy. We were making these different fish at home. So I had a backache, which just seemed to be this chronic low backache. I had a kind of a chronic low level headache, and my memory was not as sharp. There are things that an OB/GYN, that a doctor says every day. You're telling people about their birth control. You're telling people about medications that they use for hormone replacement therapy every single day. You're using these words all the time. And I was noticing that I was having trouble remembering the names of certain medications. It was very striking to me. I mean, it wasn't striking until I realized that this could be a sign. And my mercury had gone up to 14. And you shouldn't have any. We talk about a safe level being sort of less than 4, and I think it's milligrams per deciliter, but don't quote me on that. So I mean, it could be nanograms, I'm not really sure, but it's should be less than 4. I was seeing a lot of my patients pre-pregnancy, when I would test them, having very high mercury levels. And the half-life is about 90 days. It's 3 months. So it takes about 3 months to get your level. So for me, in 3 months, I got my level from 14 to 7, and then in 6 months down. And then I went on a little trip, and I was again eating small fish, which I thought would be safe, because that was all there was. There was no vegan food on this cruise, and I hadn't yet become vegan anyway. So I was eating some small fish, and it crept back up to 11. So it's really insidious, and it's all over. And I wasn't even thinking about other chemicals in fish. But now they're saying, there's practically more, and certainly by 2050, there'll be more plastic in the oceans than fish. We're sort of running out of fish. It's way past time to stop eating fish. And why the American College of OB/GYN still says we should be eating low mercury fish twice a week when you're pregnant. I mean, I know what this is about. It's about the importance of the omega-3 fatty acids for the baby, right? The DHA, very important. But you can get that from where the fish get it, right? As Gregor says, like, leave out the middle fish and just eat the algae-based DHA supplement. And a lot of prenatal vitamins actually come with a separate DHA supplement. We always recommend 250 milligrams of DHA or DHA and EPA for the baby's brain. But you don't have to eat the fish. I don't understand.
Yeah, I know.
It's the same with calcium, right? It's the same with calcium. I mean, that's why they're telling you to drink the milk every day. But you don't need cow's milk any more than you need horse's milk, right? You just don't. You can get your vitamin D elsewhere, and your calcium elsewhere, but you have to think about it, right? You have to think about it, because 1,000 milligrams doesn't drop off it isn't like, it's not a drop. 1,000 milligrams of calcium takes some effort.
And if your OB/GYN isn't plant-based or certified in lifestyle medicine, you're not going to know this.
Oh, it's very sad.
Oh. So we've got a lot of people have questions for you, some in the chat, some that were sent in. But Molly says, My 24-year-old daughter was just, because there's a lot of questions on PCOS, what causes it. And she says, my 24-year-old daughter was just diagnosed with PCOS. She's whole food, plant-based vegan, weighs 120, no sign of diabetes or pre-diabetes, which often accompanies it. She does eat oil, but striving to cut it out, understanding it's not a healthy food. She's not excited about her OB's only suggestion, which is birth control. Is there anything more she can do from a plant-based perspective to reverse her PCOS and preserve her chances of fertility down the road? Also, any recommendations for online plant-based docs she can make contact with? Well, you do coaching online, right? Like she could see you if she wanted to virtually.
She could, absolutely. Well, first I'd like to say, and I'm sure that you make these kinds of disclaimers, that I'm not your doctor, right? So I'm going to give you some general information about PCOS, but I'm not caring for you specifically. So I don't want you to say, Dr. Shapiro said you should be doing this, right? You need to talk to your own clinician. Although there is plant-based telehealth, plantbasedtelehealth.com, plantbasedtelehealth.com, and you can speak to amazing people, Dr. Marbus and Dr. Christina Miller and Dr. Clapper. And so you can actually consult with a plant-based doctor expert as a physician. Could order tests for you and do everything. Okay, that being said, I have reversed PCOS in patients. Now, this is this interesting case because usually they're not already plant-based, right? They're already, they may be vegetarian, but relying heavily on things like ghee, oxidized cholesterol, or butter or dairy. But I think one thing that you could look at, and you did mention that your daughter was still using oil, and that is the influence of something called advanced glycation end products. Advanced glycation end products, think about AGEs or things that age you, but these are the chemicals in food that are created when food is heated to high temperature. So anytime people are eating anything fried or even roasted, you're going to have increased AGEs. And you can actually look up tables of AGEs in food, and you can see that the highest are things like processed, like fried meat, like bacon, probably, or fried sausage is going to have the highest AGEs. And that goes all the way down to the foods that have the lowest, which would be orange juice. So the first thing I would say is that she could do everything possible to lower her exposure to AGEs, because women with PCOS have twice the amount of AGEs in their blood than women who don't. So if there's oil, I would cut out the oil. And I know that you, Chef, are very low fat, which is fantastic. When you're pregnant, you can't actually be that low fat. And there can be issues with fertility when people are too thin as well. So really aim for that middle ground. And so there are whole plant food sources of fat. And if a person wants some fat, then that's where to get them. So there's avocados and olives if they're not cured with too much salt. There's nuts and seeds. So in moderation, if they're trigger foods for you, count them out and be very specific about it. But I would get rid of the oil. And I would never touch fried food. There's the 2,000-year-old man. I don't know if you ever heard that. There is a comedy sketch with Mel Brooks, very famous. Mel Brooks and Carl Reiner, the 2,000-year-old man. He's a 2,000-year-old man. They ask him, so, how did you get to be 2,000 years? And he says, well, I never, ever, 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 ever touch fried food. And I always think about that when there's anything on the plate that's fried. 2,000-year-old man never touched fried food. And I know it's comedy, but still, there's a kernel of truth in that. So think about that with PCOS. So that's my only little kernel of wisdom for you. And then to reach out to the doctors, either if you want to coach, I'm here at A New View of Food, but also if you wanted a doc, then it's plantbasedtelehealth.com.
Great, thank you. Sonia wrote in a question saying, is there anything that can help with postpartum hair loss? Any specific plant-based food she should be eating? She's whole food plant-based already.
Yeah, that's so interesting that your people are already doing everything. If you're already doing everything and you feel like your diet is completely optimized and there still is an issue, I'll tell you honestly, I had an issue. And maybe my diet wasn't quite as optimized as yours, but it was as much as I could be. And I developed a skin condition related to stress. And my sister had cancer and I was very, very, very stressed. And I developed a skin condition. And honestly, it was not helped. And I had to go on some antibiotics. So I'm not saying, I'm not your doctor. I'm not saying you need to go on antibiotics for hair loss. But I'm saying that sometimes things can happen to you, even when you do everything right. Okay, so it may not be that there's something I can tweak or we could tweak in your diet that would cause your hair to go back. On the other hand, I know my colleagues Jean Schumacher, has worked with a client who had lost their hair and then went on a plant-based diet, got their hair back. But you're already on a plant-based diet. So I'm sorry, I guess I would reach out to a plant-based internist, like at Plant-Based Telehealth, because remember, I am just an OBGYN. And dermatologists really are the specialists. And sometimes you do need little steroid injections and you can get hair back. I'm not sure if you have actual, I don't know what the cause of your hair loss is. Some changes, so it might, I think it's worth actually seeing a doctor to see what that's about. And maybe you've already done that. So I'm sorry, I don't have any.
Right, well, we have a plant-based dermatologist on this show frequently, Dr. Jessica Krantz. So, and I think she answered that in one of them, but when you do this many interviews, I can't always remember what everybody said. So Amber said, do you know a good alternative for the glucose test for women avoiding ingesting crappy food?
Yes. It's funny, the alternative that I knew of when I was practicing obstetrics was this number of jelly beans. And now that I think about it, jelly beans are really not much better. It is just a glucose solution. So I wonder if there's some way that you could just say, I need a 50-gram glucose solution without all the artificial dyes, because it might be colored yellow or something. But really, glucose is glucose, and I would think the pharmacy should be able just to make up a glucose solution. And glucose would be fine, but that's what they want you to do. I don't think you could substitute and have a bunch of dates. I mean, I think you really need the glucose solution. So no, but what's interesting actually about that is thinking about all the things that we expose women to in pregnancy. And there's another one that I don't want you to think too hard about, but I do want you to at least think about and maybe ask your radiologist about, and that is the gel, the radiological gel that they put on you for ultrasounds, because there can be some parabens in that you really don't want. And anything that's on your skin does get absorbed. I stopped dyeing my hair finally, but it's absorbed. So I think this is a time, especially when you're pregnant, that you might want to think about all those things that you put on your skin, especially your personal care products as well. So that may be actually things that you do all the time may be more dangerous than drinking the 50 grams of glucose once, passing that test.
Great. Here's a question from Lisa, and she said, I tried for years as a sad diet eater using fertility doctors throughout the entire time. She said for 20 years and never got pregnant, or I miscarried when I did. But as soon as I went on Chef AJ's program, Whole Food Plant-Based Sofas Free, at the age of 5, I got pregnant and had a healthy baby. What are the specific biological benefits that occurred when I went on the better diet? The reason I ask is because women struggling with fertility often don't see the benefits of going on a better diet. And they ask me what actually happened to my body. I don't have an explanation.
Well, fantastic. You said at the age of 5, did you mean 50 at the age of 5?
Age of 45, she got pregnant without fertility treatments after doing fertility treatments for 20 years and either being unsuccessful or miscarrying.
We're interviewing a woman for our summit with a similar story. She got pregnant once and had a child and then had many, many, many years of infertility and was told that she would be completely infertile. So your story is outstanding, not entirely unique, but do we understand it? I think a lot of it has to do with oxidative stress in ways that maybe we don't. I mean, we really would have to drill down to, on the molecular level inside of these cells. And it's the hormones themselves and how they get turned on and turned off. And I think you're going to have to think about it just in the usual ways: reducing oxidative stress, reducing inflammation, and understanding that those and really gut bacteria. How do we know really how the microbiome is the new frontier, and maybe that also plays a role. It certainly plays a role in things like our immune system and the serotonin and other brain hormones. So I think all of this. Reducing lipotoxicity. So all of those 4 drivers of disease, all being helped by our diets, and in ways that we don't completely understand, we don't have to understand, but I'm very happy for you. That's thrilling.
Yeah, that's amazing. Georgia says, can type 1 diabetics go vegan during their pregnancy?
Type 1 diabetics can absolutely go plant-based during their, yes. I mean, you must know, I know that you know about Cyrus Kambata and Robbie Barbero, all about the mastering diabetes. These are both type 1 diabetics. I think if you're asking, can we go off our insulin? No, you will always need insulin. As far as I know, I mean, there may be some cases that people have, you can certainly reduce your insulin need, but for the most part, those beta cells if you're type 1 diabetic, those beta cells in your pancreas are not going to suddenly just spring to life and start making insulin. They just aren't. But in addition to not being able to make insulin, you can also have, for sure, insulin resistance at the level of the cells. And insulin resistance, you know, is just when there's this fat inside of the muscle cells that interferes with the insulin receptor. So we cannot open these channels in the cell wall in the cell membrane to let the glucose in. And that's diet and probably lifestyle as well. But so you could definitely reduce your insulin resistance. You'll always need to take some insulin, but you can definitely reduce your insulin resistance and eat very well and improve the health of your child. Will your doctor tell you this? Probably not.
Yeah.
You know, we're really working on it. I remember going, I don't know if you go to these conferences, but I remember sort of 7 years ago going to it was the second annual, I could be wrong with the dates, but it was the second annual International Plant-Based Nutrition Healthcare Conference. I had missed the first, but I came to the second, and there were only maybe 300 people there. But as I've been going now every single year, there are over 1,000 doctors, mostly doctors, and also PCRM's conference, the International Plant-Based Nutrition Healthcare Conference, over 1,000. It's hard to even get them in one room. Over 1,000 doctors now. So there is increasing interest in disease prevention and reversal. There's even a journal of disease prevention and reversal now, the International Journal of Disease Reversal and Prevention. So there is interest in this, but back to your question specifically, can you be type 1 diabetic and vegan? Absolutely.
Yeah, and it's okay to change your diet during pregnancy, even if you're already pregnant and already a type 1 diabetic.
Well,
right?
What's important about getting pregnant when you're a type 1 diabetic is making sure that your hemoglobin A1C is in control. If your hemoglobin A1C is not in control, then you are more likely to miscarry, and you're also more likely to have a child with a birth defect. Having high levels of glucose in your blood is going to affect the early embryonic development. So that's the most important thing. Once can you change your diet? The problem is when you're pregnant, and that's again why I really want women to think about this before they get pregnant. It's a tricky time, and if you're gonna, and the most important thing is glucose control for you, not to get too low. Right? Not to get too low, not to get too high, but to be in control. I would work with a plant-based dietitian who's comfortable working with someone, a type 1 diabetic, and I would follow their advice to the letter and be very, very careful. Maybe use one of those free Libres, really make sure that you're not getting too high or too low, because it's very important for the fetus that you have normalized blood sugars while you're pregnant, especially in the early days.
Right. Thank you. Boyer says, is there a connection between poor diet and endometriosis?
Oh, yes. There's even a relationship. I know you just asked about diet, but there's also an influence of endocrine disrupting chemicals and that you're exposed to in the womb and developing endometriosis later on. It's really frightening. So sometimes people get endometriosis and they think, well, it's something they did. You could just think it's your diet, but maybe not. Maybe it was your mother was exposed to something that led to you getting, but we know that there is a familial, there's some genetic connections as well. People in families, you're more likely to have endometriosis if people in your family have it, or sister. They've done twin studies. But you were asking specifically about diet. Yes. And actually, Neil Barnard has a wonderful book called Your Body in Balance, where he talks, I'm sure you've interviewed him, where he talks about people who have had terrible endometriosis. And we have interviewed them as well for our summit, women who were actually now, I have to say, I have friends who at very early ages had complete hysterectomies and oophorectomies. That means their uterus tubes and ovaries were taken out of them before age 30 because of horrendous endometriosis, when the lining of the uterus, if people don't know, the lining of the uterus, the endometrium, implants outside on the tubes, on the ovaries, on the bowel, on the bladder, causes tremendous pain, sometimes causes scarring. You can imagine every month when you'd be bleeding inside your uterus and it would flow out your flow out the cervix and the vagina. Well, these little implants of endometrium are bleeding wherever they are. They're bleeding on the ovaries, and they're causing these, what we call them, chocolate cysts, or these old blood-filled cysts. And then there's scarring after that. And you can, the pictures of this online, if you're not looking in the operating room, the pictures are incredible. I remember operating on somebody to have a hysterectomy, and it was like someone had poured concrete into their pelvis. It was completely socked in. And so I had friends who had, these 3 friends who had complete, total hysterectomies and oophorectomies at very young ages because of endometriosis. Well, I had no idea that this could be reversed. I was not taught that in medical school. I wasn't taught that at all, but it's true. And if I had my patients now going on a completely low-fat, whole food, plant-based diet, I believe we could get reversal in many cases, and a reduction in pain. We know that certain foods can actually help with the pain of endometriosis. Dr. Greger talks about this. It's seaweed, actually. Things like nori can help with the pain of endometriosis. But to actually see it reverse and to go on and get pregnant, this woman was literally on the table. Doctor opened her up thinking that she was going to have a complete hysterectomy and oophorectomy, and then he ended up just snipping one little adhesion and said, I don't see anything else. Isn't that amazing?
It's amazing.
It's terrible what women are not being told.
Miracles of plant-based eating.
Yes, we've all experienced it, right?
Absolutely. Elizabeth says, what do you recommend for someone diagnosed with fibroids and cysts? I've known people that have had that and gone to the True North Health Center, did a water fast, and gone.
Yes, I know. Water fasting is really remarkable. I haven't never done it. I've done some juice fast, but I've never done a water only fast. It seems a little scary, but I know that they published some incredible results, even early lymphomas regressing with water only. So with water only fasting. But again, I would not recommend you do this at home. So prolonged water only fasting, if you want to do water only for a couple of days, that's probably okay. But anything more than just a weekend, definitely you have to do it under physician guidance. So that being said.
And not while you're pregnant, for sure.
Oh my goodness, no. But the question was about cysts. Well, and fibroids. Dr. Barnard also talks about people who've had fibroids regress. I have to say, again, I was not taught this. And when I think about when I take my boards and I study for tests every year with and read articles to be recertified in obstetrics and gynecology, they're not showing me articles about or even case reports of people reversing, their symptomatic fibroids with diet. That being said, I'm sure that people are able to do this, but I personally have not had an experience with fibroids actually regressing. But remember, I left my very large practice and went to a smaller practice at Genentech. So I don't have the large group of women that I could try to sort of experiment on by giving them diets. But the cysts, I don't know about, I would like to speak about breast cysts just for a second. I definitely know people who have suffered greatly from painful, large breast cysts. They would, they'd start to feel it as heaviness. They'd go into for an ultrasound and they'd show this really large fluid-filled sac, and they drain it or they wouldn't, or we'd follow it. But go on a plant-based diet and that just stops.
Nice. I don't know if this is considered a cyst or something different, but Joan says, is there a reason to develop a teratoma on my ovary? This was before I was whole food plant-based.
No, teratoma. Well, a teratoma is really an interesting tumor. It's a germ cell tumor. So in our ovaries, we have germ cells, and we also have follicular cells and granulosa cells and different supportive cells. So there are different kinds of cells in the ovary. And this is actually one of the reasons that they think that ovarian cancer actually starts in the fallopian tube, because really all the cells that we associated, all the cell types that we associated with the deadly kind of ovarian cancer, the epithelial cells, the serous cells, and the mucinous cells, those are not actually cells of the ovary. Those are cells of the fallopian tube. But that's for another day. But the cells that are in the ovary are these germ cells and granulosa cells, right? And follicular cells. So the germ cell is going to become a baby. So when it's fertilized, so it has all the genetic material to make hair, teeth, nails, sebum, right? The stuff that's inside of your sebaceous cells. And these tumors are fabulous. When you get to them in the operating room and you open them up and you actually find hair, little bits of hair. And Sometimes you actually find thyroid tissue, and sometimes they even find thyroid cancers inside of a teratoma. So I don't want you to think that you're going to find some baby developing in this tumor. You don't, but you find these either mature elements or immature elements, just to show what a germ cell can do, what your ovaries actually can do. These are totipotent cells. But could a plant-based diet have any effect? I don't think anyone really knows.
Wow, that's fascinating.
But in terms of anything growing, it is interesting, right? Because we know that when we have animal protein, we're increasing something called IGF-1, insulin-like growth factor 1, and it makes things grow. So that's just one of the reasons that eating more plants and getting away from animal protein might cause less cancers. And we are seeing sort of an increase in childhood cancers, for example, and over the years with more animal products being ingested. So couldn't hurt.
This is anecdotal, of course, but my husband, when we were just regular vegans, we've been SOS free since about August 1st, 2008. He had a cyst about this size on his back. I think it's called a lipoma. It was benign, but it was about this big. And it was really unsightly because he's a really lean guy. And when we went oil free within 9 months, you can there's like the tiniest, it's like gone. That was yeah.
Interesting that you mentioned that, because a lipoma is a fatty tumor. It's a fat collection. And that's why if you're very lean and the rest of your body doesn't have a lot of fat on it, this will become more prominent because it just is this tumor of fat cells. But it's fabulous that you got that to go away. That's amazing.
Yeah. So Amy says, can you give some advice for women who eat plant-based but have borderline gestational diabetes? I'm oil-free, but I've been eating large amounts of chia and flax, about half a cup a day. How much fat should I make sure I get at 29 weeks of pregnancy?
Oh, good question. Okay, so in pregnancy, your diet should be about 20% fat. 20% fat. And so you can work out, actually at that stage, you do need 50% more protein, right? So you know that. There's a wonderful book called Becoming Vegan by Brenda Davis. And she has a chapter on pregnancy and childbirth and even after that. But that chapter is magnificent for telling you exactly how much of everything. But I would say about 20% fat by weight. 20% of your calories should be fat. And you need about maybe even 300 or 400 extra calories at that time too. So it's like 2,400 calories, right? And then 20% of that, and then you could figure out how many grams of fat. So what was the issue again about the fat? How much, or too little, or getting down?
She said
insulin resistance, right?
Had borderline gestational diabetes.
Yes, right. So what the interesting thing is, I remember that we interviewed someone who she had been obese or heavier in the past, and then lost a lot of weight, and then got pregnant, and did still have some insulin resistance, residual. So yeah, sometimes you just have to do your best. I don't think that you should, the amount of fat in your diet needs to be about 20%. I wouldn't try to bring it down too much lower in pregnancy. And if you have gestational diabetes because of that insulin resistance, then I'm hoping that just with a plant-based diet, you should be able to manage that with diet and not have to go on insulin. But I would not recommend, I can't recommend, again, I'm not a dietitian, I'm not a registered dietitian. I read a lot, and I've talked to dietitians, and I've heard them speak. So I would recommend Brenda Davis. There's a new book by Reshma Shah and Brenda Davis. It's fabulous, called Nourish. It's the definitive plant-based guide for raising plant-based families. I might be getting the name a little bit off, but it's called Nourish. And it's a fabulous book. Again, it will talk about how all the different macronutrients and micronutrients that you need before pregnancy, during pregnancy, and while breastfeeding, and also while raising a plant-based child at all stages of development. So really a fabulous, fabulous book to have, Nourish. I recommend everybody have it on their shelf if they're thinking about having a child or raising a plant-based family.
Terrific, thank you. Katie says, does caffeine increase estrogen, cause PMS, or sore boobs?
Oh, okay. It's interesting because I know there are doctors who believe this. Absolutely. And I've heard them speak, OBGYNs. Again, it's not what I was taught. I don't know. I'm not an expert. I've definitely heard people talk about that caffeine increases estrogen. I have not been taught that. I've never really heard that in the literature. I've only heard it from other people. So I'm not going to speak to that. If you drink more than, I don't know if we're talking about pregnancy, but if you drink more than a cup a day, or 1 or 2 cups a day, but I would say 1 cup a day, there is an increased risk of miscarriage. And I would not recommend, if you're someone who drinks a pot of coffee a day, if you're trying to get pregnant, I would bring that way down. Try to get by with a cup a day. There's something in coffee, tea, chocolate, even aspirin. It's called methylxanthines. So methylxanthines are not exactly the same as caffeine, but they kind of run together in certain things that you might be eating. So it's the methylxanthines that seem to increase breast cysts and so fibrocystic tissue for some women. Some women no, but a lot of women yes. So if you go through months, I know that there have been times for me, even when I had more caffeine than other times, and that month, this was before I was menopausal, I would really notice it. They would be very achy before my period. And then if I tell my patients the same thing, if you tell them to get off of dairy and if you tell them to lower their caffeine intake or their methylxanthine intake, coffee, tea, and chocolate, then they will notice a change. So not everyone, but yes, I would definitely give it a try. You'll know within a month or two. You'll know very quickly if you're sensitive to that product.
All the people I know that have had breast cysts, they were told not to have chocolate or caffeine.
It's the methylxanthines, yes.
Interesting, because now I know why. I don't know if this is your exact area of expertise, but I'll ask it. And if you can't,
Okay.
that's fine. But Ruth says, can you heal a UTI with a plant-based diet? If not, what antibiotic should be used, and how can I best recover my microbiome?
Okay, interesting. So there is some new data actually about cranberry actually being tested and actually being shown, cranberry capsules and cranberry concentrate, not cranberry juice with a lot of sugar, but unsugared, to help prevent bladder infections by preventing the adhesion of the bacteria to the cell wall, to the wall of the bladder. The other is D-mannose, I believe, which may be another one. So I'm not a specialist in all that, and you might need to talk to another doctor about that, because I haven't been using D-mannose, and I'm just sort of learning about that. But you can look it up also on PubMed and see. But if you actually have an infection meaning that you have a pathogen in large enough numbers to really be problematic. So I'm not saying that someone did and found a little bit of some groupie strep when you're not pregnant, and just maybe 10,000 colony forming units, and you feel a little uncomfortable. You could drink a lot of water or cranberry, unsweetened cranberry juice, and it goes away. I'm not talking about that. I'm talking about that you have a bladder infection because it hurts like heck, and every time you pee it burns, and you get a culture, and it grows over 100,000 colony forming units per ml of a pathogen like E. coli or something like that, and it's sensitive to certain antibiotics. I would not take any chances with that, because if you have an infection that's sitting there for a long time, it will ascend into your kidneys, and you can end up with a kidney infection that can become a blood infection, and it can actually be fatal. So no reason to put yourself through that. I would just take 3 days of antibiotics. You don't need a week of antibiotics. You need 3 days of antibiotics, and you could take something like, you don't need to take Cipro, it's like like crushing a mosquito. God forbid we don't, right? But we just try to take them outside. But a mosquito with a hammer, you don't need to do that. But something like Macrodin or Bactrim, something. Actually, sometimes there's a lot of E. coli that is resistant to a lot of different antibiotics, and I don't know whether vegans get these as often as people who eat chicken, because a lot of the E. coli is coming from chicken, but you can. And I've seen some bladder cultures, some urine cultures that just show, resistant. It's horrible. It's scary, really scary. So sometimes you have to tailor the antibiotic to your particular organism. And there's nothing you can do about that. You must kill this. You must kill this off. And then to get your bacteria back, you just have to eat more whole plant foods. I think there's enough to say right now that you don't need to use those probiotics. You can eat maybe some probiotic containing foods. that's not too high in salt. But I have a salsa that's a probiotic salsa. But honestly, just feed the bacteria that you want the best food. So whole grains, right? Fruits, vegetables, whole grains, and legumes, nuts and seeds, spices, and you will have the bacteria back very quickly. They've seen that. They've showed that. You can change your bacteria very quickly.
That's fantastic. Lissa says, Dr. Shapiro is vivacious. What fun to listen to her enthusiasm about health. And she wanted to know, what is your recommendation for the best A1C?
Oh, less than 5.7. Less than 5.7. So it's, 5.7, I think it's 5.8 to 6.4 is pre-diabetes, and 6.5 and up is going to be diabetic. And you really want to be below, so 5.7 or below. So if you could be 5.3, 5.4, just, yeah. No, wait, that's for someone who's not diabetic. If you're diabetic, then if you can even be as low as you can be would be lovely. And you would talk to your endocrinologist before you get pregnant. So are we talking about someone who's pregnant or wants to be pregnant and diabetic? That would be different. And I would just get as close to, as low as you can go.
I think of that, how low can you go?
Right. Well, I've seen diabetics have miscarriages, and I've seen diabetics have miscarriages late in the second trimester, a little bit later, and it's horrendous.
So Richard says, my wife had a subchronic hemorrhage and then a stillbirth at 21 weeks. Is there anything she can do to prevent it in the future?
Oh, my heart goes out to you. Oh my goodness, Richard. And thank you for being on this call and for being supportive of your spouse. This is, obstetrics and gynecology is the most wonderful specialty. It's primary care for women. It's seeing women year after year. It's seeing women in all stages of life. It's doing surgery, life-saving surgery, and it's delivering babies. And with that, there's the most incredible highs, the most incredible joy in the world. There's nothing better than being in that room when there's a new life coming into it. And there's nothing worse when there's a loss than when there's a loss. It's profound, and it's truly a disaster. So what can you do? So first, of course, there's just healing, emotional healing from all of that, and not rushing necessarily into something else and something new, and not always feeling like, well, we'll just cover that up and just, have another, because you can't really, you don't really cover it up. So you need to deal with the grief and take that time to deal with the grief. But that being said, I think talking to a plant-based specialist, someone who could really, I'm not sure you said if you were already optimizing your nutrition and your lifestyle prior to this, but making, there are lab tests that need to be drawn. We need to know if this was a chromosomal disorder, if this was a problem, an autoimmune condition, like a antiphospholipid antibody syndrome. So I would definitely talk back, they should have done some studies, even some chromosomal studies on the fetus and on your child. And so we should have a little more information to help guide us about what could be done. And I'd be happy to consult. You can always reach out to me and if you wanted a consultation, but that's a very specific question, because we know actually now that it's LDL cholesterol, that actually these LDL cholesterol crystals that are in what we call the decidua, which is the lining of the uterus just adjacent to the placenta. So the LDL cholesterol crystals, which seem to be involved in the inflammation causing preeclampsia, and preeclampsia can lead to a disaster like this as well. So I think just optimizing nutrition, optimizing health, and of course, healing from the grief of this loss.
Right. We've been talking a lot about pregnancy, but most of my audience is not in childbearing years. So I'm glad this question came up just now from Lana. Any dietary suggestions for vaginal dryness early in menopause? And maybe you can talk about, because I'm sure I must have gone through menopause. I'm 61, but I don't have a single symptom. I don't even know what people are talking about. I'm all hot flashes. That's why I moved to Palm Springs, because I was always cold. So I remember my mom with a towel always, but me and my sister, we've been vegan so long, we're still waiting for a symptom.
That's amazing. That's fantastic. So I think that you could probably say that it could be overall your health and wellness, but it could be the soy. I don't know. Are you someone who does indulge in some soy?
I'm allergic to soy. I've always been. So I take no soy.
Then I have no explanation. Because normally we would say have more soy, because the phytoestrogens in soy will definitely help, and they help with hot flashes. And Neil Barnard talks about that as well. And there've been some good studies, and you can look up Mark Messina, RD. He's really wonderful. He's a soy king. He knows all about soy. He's been studying it for decades, and he has some wonderful articles online about soy and everything it can do for the menopause. So increasing the phytoestrogens will definitely help. But that's incredible that you also have not, that even though you are allergic to soy, that you've also had a very easy menopause. And it's, you know, it is partly genetic. So you saw your mom go through a hard menopause, a difficult menopause, a challenging one, and yet yours was easy. So there's something to that. And I can't really explain that.
So she was obese and she was not vegan.
I was just going to say that about obesity too, right? But there is a thing like tachykinin. I think it's called tachykinin B. There's some receptor in the brain, and it has to do with, you know, with your set point, with your temperature set point, and being more sensitive to small changes in temperature. So that being said, if you're not allergic to soy, I would increase your soy. But you were asking about, not about hot flashes. You were asking specifically about vaginal dryness, which is a problem, not so much right at menopause, but usually with about, I saw in my patients about 5 years later. And especially if you're trying to be sexually active with a man, or with something that goes inside the vagina. As a lesbian, we don't do too much of that, but some people do. So there's anything wrong with it. So, but that can really be a problem. And if you just use a lubricant, it can make things a little slipperier and slide better, but it will not actually increase what you're experiencing, which is the dryness, but it's really the loss of it being of the vagina being more flexible. It becomes stiff and inelastic, and that's the loss of estrogen. And I do not know, other than using phytoestrogens, and there are no vaginal, that I know of, vaginal supplements of phytoestrogens, that will help. I do not know of any. So there's that. If it really is bothering you, then there is vaginal estrogen that is safe. It doesn't increase your risk of breast cancer. It's just little tablets or creams, but I would use little tablets of Vagifem that go inside the vagina and melt in there, and they just make the vagina more elastic. But also you have to use it. So it's one of those things. It's just like your any muscle. It's just like your muscles, even though the vagina's got some muscle. But is that use it or lose it. So if you do not have anything inside the vagina, if you do not have intercourse for a long period of time, then the vagina will just get stiffer and stiffer and more inelastic. And then when you try to have intercourse, it will be, or even just go to your doctor to have a pap smear, it will be sort of excruciating. So I don't know, anyway, it's too personal. But anyway, I've noticed it myself is kind of hard. So as a patient, so you might want to think about using I don't usually talk about a lot of medications, but I don't think there's anything really wrong with using a little vaginal estrogen if you want to be more comfortable. I'm not the kind of doctor that actually says, all meds are terrible. It's just a fact of life. Sometimes you just need something. I had that terrible skin condition. I had to take antibiotics. So if you have a bladder infection, you have to take antibiotics.
Is Vagifem the same as like estrase cream?
Yeah, it's very similar. It is estrase. It is estradiol, but it's estradiol put into a little tablet that you have on a little applicator. Now it's true, I wish they would actually make one applicator and then you could stick it, put it into each tablet and reload it, because it's a lot of garbage, because it's the plastic applicator gets thrown away. So there are these tubes and just the cream, but the cream is a cream. So there's some issues with that. But either way, the only thing I wouldn't do is I would not use Premarin, because Premarin is from pregnant mare's urine. And I am an ethical vegan. And so that means that just like with cows, that they keep these cows, connected to hose, and they collect cows' milk. So the same thing they do with these horses. They keep them connected. They have a big bucket under their, kind of big sack under their bladders, urethras, and they collect all this urine, and they have horrible lives too. So, and there are these Premarin horse farms up in Canada, and it's pretty despicable. So stay away from Premarin. I'm probably going to get sued by the Premarin. Stay away from pregnant mare's urine anywhere you find it. Okay, no reason for that, because we have these alternatives, plant-based alternatives that are. So it's called it's estradiol, and it's in estrase products and Vagifem also.
Wow, thank you. Well, I'm sure Linda Middlesworth is watching, and I'm sure she appreciates that you're also an ethical vegan. You're just a treasure trove of information.
Well, I'm glad that I could be helpful to your listeners today. It's really been a thrill.
Yeah.
It's always really wonderful to talk to someone who's walking the walk and talking, doing it all, as you are. And I have so much respect for you, Chef.
Well, do you have a book that we can look forward to?
No book. No book, but we have an upcoming summit that I think is going to be amazing with some incredible speakers. You have Brenda Davis and Reshma Shaw and Michael Clapper and Neil Barnard. And we just have some amazing speakers. We have Jorge Chavarro, actually, and among others. So it's a summit. It's called the Pregnancy Advantage Fertility Summit, and it's going to be advertised very shortly. Really by Monday, I think tomorrow or the next day, and it'll be running from June 6th for a week. We're going to have 3 to 4 lectures every day, just like your Better Life Summits, just like your summits that you're doing. And I think it's really this whole way of thinking about preparing for pregnancy, both men and women preparing for pregnancy, so that your child will be as healthy as possible. We'll just be able to start running on the ground, running with the best genetic material, the best gene expression possible. And not only health, not only diet and lifestyle, but reducing the toxin exposure too. We have Jeffrey Smith, who talks about GMOs and glyphosate, and it's really a shame of what's happened in in my lifetime, right? In our lifetime, we're the same age, 61. In our lifetime, everything has shifted, and we live in a very polluted environment. And it's not going, we have to change. We can't raise the next generation eating the way I was raised. We just can't. There aren't enough resources to go around. So it's going to have to be, and I think the summit's going to play a good role in that. I think people will enjoy it.
Well, when you get the information for the summit, just let me know and I'll add it to the show notes, because right now I have your LinkedIn, Twitter, Facebook, and Instagram, and your website, and there is a free ebook people can get.
Oh yes, an ebook. Yes, Why Eat Plants, just a little ebook, and I have videos on the website, and you can on anewviewoffood.com, and you can definitely find me there. You can through Calendly, you can make an appointment, and we'll just talk for.
And if people live near you, can they see you as a doctor?
Actually, only if they work at Genentech, because right now I work only at Genentech on Tuesdays. So if you work at Genentech, I'm there. Or if you a contractor and happen to be there, we will see you. But no, I am a coach for everybody else. So I'm coaching privately and trying to do what you do, right? Just trying to help people experience what can happen to them when they eat a diet of whole plant foods. And it is remarkable.
Where do you hang out most? Is it Facebook? Is it Instagram?
I suppose it's Facebook, but I need to do more. I actually have a coach. All coaches should have a coach. I have a coach, and I have made a little deal with myself that I would be trying to post. I do post some food on Instagram, but I don't know how to do all. I'm 61. Have all those. What are those hashtags?
I know. I have a company do it for me. I don't understand it at all. So yeah.
Please, I know we're a little challenged, but I love to talk on the phone. You can reach out to me, and I'm available, and I would love to help you. If you really want to thrive on plants, reverse disease, I've reversed Crohn's, I've reversed osteoarthritis, I've reversed diabetes, reversed hypertension. You want to get off of medications, we can do that. If you want to do it, we can do it.
I love it. Thank you. It's just such a pleasure getting to know you more.
Really a pleasure to know you too. Thank you so much. And your listeners, wonderful questions. You guys, I love how engaged you all are. Thank you. And to the man whose husband had a loss, I'm so sorry. And I hope that you can.
The wife had the loss. The wife.
Well, but they had a loss. Right?
They had a loss together. Yeah.
Loss.
Right. Okay.
Right. Sometimes people don't realize it, how distressing it can be for the husband too. I mean, everyone's so.
I saw a question come in. You want to take it?
Of course, if you have the time, of course.
Mike Shah says, can you talk about ectopic pregnancies? Is there any hope if you've had 6 of them?
Oh dear. Okay, those fallopian tubes need to be removed. An ectopic pregnancy, are these tubal pregnancies? Are these pregnancies in the tube? I'm extrapolating a little bit on this. I'm assuming they're in the fallopian tube, and 6 of them. I've never heard of such. I mean, sometimes one would have one, and we would decide, looking at the fallopian tube, maybe the pregnancy had already been extruded out the end of the tube, or we were able to open the tube and just kind of suck out and leave it open. It's called salpingostomy. So sometimes we don't remove the fallopian tube. It kind of depends on the whole picture. As we look at the other tube, but it is sort of a little, an exclamation point. It sort of is a warning sign. There's something going on. There's something going on with those fallopian tubes, and they're not functioning well to bring the egg and sperm back to the uterus. And that's happening over and over again. I'll just want you to know this is and the other way to treat an ectopic pregnancy, and that might have happened a couple of times, is that it's caught very, very early when the hormone of pregnancy is still quite low and the woman is not symptomatic and they're not bleeding and nothing's ruptured. And so you can just give the patient some methotrexate medication that blocks the progesterone, and the pregnancy just kind of shrinks up, goes away, and you can follow that HCG all the way down. So that might have happened. That might have happened too. So I guess it could be a combination. But I wouldn't go the natural route anymore. It's too dangerous. It's too dangerous because I have seen people hemorrhage and die. And I know of people who have died on the way to the hospital, in the parking lot getting into the emergency room. I wouldn't take any chances with that. If that's happened so many times, there's something wrong with those fallopian tubes. And so I would do a workaround. And luckily, in this day and age, we have the workaround. So you remove the fallopian tubes, and you do in vitro fertilization with a healthy embryo.
Wow, great.
I'm sorry to say that. I mean, I'm really sorry that happened, but I can't think, and I'm not an infertility specialist. So, but that's and again, we gave this disclaimer at the beginning, right? I'm not your doctor. I'm only giving some general advice from what I know, but that's all I can think of. If there's another OBGYN listening who has another opinion, please speak up. But I can't, that's a lot of warning signs. And next time you may not catch it that early. I mean, you probably will, because I'm sure you're checking right after 3 days after fertilization, you're checking HCGs, but still, it's time to just have a baby, right? So laparoscopic salpingectomies and IVF.
All right, let's end on a fun question. What do you eat in a day?
Oh gosh, okay, good. So for breakfast, I know you love salads, and I love it. Can I just confirm with you? Because I do this all the time. So the steaming of greens that are not really steaming, you put them in the Instant Pot okay. I use a little bit of water, maybe I don't need to, and I put the gravy at the bottom.
Put a little bit in.
Okay. And then I load it all up with greens and even some broccoli that I let sit first. Any of the cruciferous vegetables have to sit for 40 minutes, right, to develop the sulforaphane before you cook them. But then load up and then I put it on high pressure, 0 minutes. That was not a sign, that was a 0. And so 0 minutes, and then a quick release with my towel over the nozzle, and they are perfect. Is that how you do it?
I do 0 minutes too.
0 minutes. It's perfect. I love it. And so I love how you talk about having greens for breakfast. So sometimes I will, but most of the time, to be perfectly honest with you, I don't. Most of the time I make a grain. So I'll have steel cut oats, or I will make whole oat groats, or I'll make Dr. Greger's Brol Bowl, which is barley, rye, oats, and lentils. So I'll make some sort of whole grains. And sometimes if I just want to be just fast and easy, I have some sort of cereals, like there's an Uncle Sam's cereal that's really just, whole grain. It's not the best, but there it is with some flax. And then I'll increase, I don't like to say beef it up. I will plant it up. So I will add my ground flax. I will add my spices. You can have a little bit of a sprinkling of some, have almond powder. You could put cinnamon. You could put nutmeg. You can put, so a little tiny bit of turmeric powder. Anything. I use any kind of variety of fruit. So berries, all kinds of berries, and cut up fruit, and add all that to my cereal. So whatever I'm eating, I try to, I might add a few walnuts. So whatever kind of berries I might have, if I have some dried cherries. So I do that. And then the rest of the time, my favorite thing to eat is a giant salad. I hate to say it, but it really is. I make these enormous salads, different kinds of greens, cruciferous, the arugula, and different kinds of greens, and then as many different vegetables I have, any different kinds of so starchy. I'll make grains to go in the salad. I'll put legumes in it. I'll have it with hummus. I'll have it with different kinds of salsas. There's something called Cowboy. There's a new product from Trader Joe's that's an oil-free salsa that's just fabulous. So anyway, I'm always thinking,
caviar?
Yes. Do you approve of that?
I think so. I generally
doesn't have any oil. I really like it. It's great. But I also at a farmer's market get another kind of a completely organic salsa that's wonderful. So, and I use vinegars. I use a Sicilian lemon balsamic vinegar in place of oil.
Oh, well, you're getting 2 free bottles of California balsamic just for being on this show. So who knows what the possibilities will hold in your future.
Thank you. So, between the hummus and the grains and the legumes, it's so creamy. It doesn't need, and I'm someone who used to go out and put gravy boats full of blue cheese dressing on my salads. I thought everything had to be, I used to put half and half in coffee, and your taste buds can change. The hardest thing is getting away from the fattiness. And you talk about that, and that mouthfeel. My wife had bought some yogurt that was coconut based, and she really wanted me to try it because my LDL cholesterol, when I was first roasting my vegetables in coconut oil, when I first went vegan, my LDL cholesterol went up to 120. But when I learned how to roast on parchment or a silpap and I got away from all the oils, my LDL cholesterol dropped from 120 to 60. And the only difference was getting rid of the coconut oil. So you cannot talk to me about how great coconut oil is. To me, it's just terrible. So you could tell, I tasted this, I had a tiny taste, and it was amazing. The mouthfeel with coconut is amazing. But you can, if you need to make a curry or you need to make something with coconut oil in it, you can use our coconut milk. You can use coconut extract and soy milk, or coconut extract and almond milk, or plain milk. So please stay away from coconut oil.
Okay.
Put it on your skin. Put it in your vagina. You can use it as a lubricant.
That's fantastic. I love that. That's so the people that were thinking it was healthy, if they have any left over, that's what they can do. That's probably the best quote of the day. Well, thank you so much, Dr. Shapiro. And thank you. Thank you for the work you do.
Thank you so much. Thank you for all the work you do.
Oh my God, it's my pleasure. And thank you all for watching another episode of Chef AJ Live. Please come back tomorrow when we have a double header at 11 a.m. We have Jennifer Helene, who works with Hippocrates Institute, and she's going to be doing a culinary demo, including a creamy asparagus soup. And at 2 p.m., Dr. Emran Meyer from UCLA, the famous gastroenterologist who has a new book out, is going to be seeing us. Thanks again, Dr. Shapiro. I hope to see you soon. Take care.